Yeah. Let me take my card.
Yes.
Meniscus tail. Okay. Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you. Today we are conducting speaking sessions and we have with us Muthu Lakshmi from Tamil Nadu, India. She is preparing for nursing specific OET test. And the card for today is this: repair for meniscal tear. There we go. I have given you
Yes, sir.
time to speak, Muthu Lakshmi, and now you are with me today. Yes. So, Muthu Lakshmi,
Yes,
so
sir.
you have got the preparation time and you have 3 minutes to prepare and you have already prepared and now we are directly jumping into the session. And are you ready?
Yes, sir. I'm ready.
So you can start once you are ready.
Yes, sir. Let's start, sir.
Yes, of course.
So, during the role play, how may I address you?
You can call me Lincoln. My name is Abraham Lincoln.
Good morning, Good morning, Mr. Lingan.
Yes, good morning, nurse.
Yes. I'm Lakshmi, one of the registered nurses working in this hospital ward. I am your attending nurse today. How are you feeling now?
Actually speaking, I feel a little bit pain. It's a bit painful and it looks very swollen. I also feel a bit tired, but I'm looking forward to go home. Looking forward to going home, sorry.
Yes. Yes. I have brought you the good news, which is you are going to be discharged tomorrow. Is that, do you aware about it?
Yeah, nurse, I was expecting that, but I was not expecting so soon.
Yes. And I would like to ask you some details regarding your pain status. Is that manageable, Mr. Lingam?
As I told you, I feel a bit painful, but it's okay. And yeah, swelling is there, and tiredness. Yeah, I cannot bear this boredom. I want to go home.
Yes, I understand your tiredness and feeling weak, but it's quite a common worry among every post-surgery. So it can be subside within 2 to 3 days. And if you have well hydrated and adequate rest, those things will really provide you the subsidization of your this tiredness and weakness. How does it sound, Mr. Lingan?
That's fine. I don't mind a bit of pain as long as my knee gets better, and that's the positive sign of it.
Yes. I can understand the difficulty to cope with this situation, but I would like to tell you some advice regarding your post discharge and the level of food has to be maintained to the elevation. And also, if you have any pain, you can go on with the painkillers which doctor has been prescribed for you. If you could maintain this legs elevation and the painkillers without fail, if you are taking the painkillers according to your pain, these symptoms can be reduced. And also, I would like to inform you the indications of infection symptoms because which is common in every surgery, postoperative infection like redness and swelling and also the any wound discharge. If you have noticed anything, these symptoms, this can be You can seek medical attention immediately so that we can avoid the further complication and risk of your wound care. Would you like to follow that?
Yeah, of course, nurse. That's really fine. I'm ready to listen to your suggestions and I'll definitely implement your points. There's no doubt regarding that. And yeah, that's fine.
Yeah. Do you have any concerns me to clarify today?
Okay, what are the other things regarding my discharge? And if anything important is there, you can break me open.
Yes, absolutely. I'll provide you the details. And I also appreciate you for your active participation towards taking care of your health. Firstly, it is highly recommended to keep your wound dry and apply the dressings. If it is falls down, kindly apply the reinforcement of dressing is mandatory so that we can avoid the complications and post-operative infection like any exposure to the outside may produce some infection. So it has to be avoided if you could maintain that wound dryness, and you have been scheduled for revisit after 5 days of your discharge. And in the meantime, the stitching material must be absorbed within the skin itself. Is that able to understand?
Yeah, that's quite a fine nurse. And yeah, what about my discharge?
Yes. Probably after the doctor's assessment of your wound, he may he may allow you to discharge and will make arrangements for the discharge procedure, but it is recommended to follow the discharge advice in further advices, which is the immobilization. If you restrict the movements and physical activity, your wound healing will be promoted to the next level and your general health also will improve. And please avoid the daily living activities and physical exercises. It would be recommended if you have any assistant support from your family members. May I
Yeah,
know anybody in your family is ready to take care of you?
yes, of course. My sister is coming to drive me home, and I live on my own, but I'll be able to manage at home with the shopping and all the other things. I don't need anyone to stay with me, and I'd like to have some time on my own to rest.
Yes, I totally understand and respect your emotions, Mr. Lingan, but this time it is mandatory to help with some other to assist your daily living activities because it may if you get into the activities physical activities it may affect your healing process and the recovery period also will stay long. So, in order to avoid such complications, it would be highly recommended to help with the assistance like your sister or any one of in your anybody from your family members. And also, it would be you are suggested to revisit the clinic after 5 days of period. The, after the doctor's assessment of your wound, will get the further treatment and I wish you a speedy recovery, Mr. Linga.
Yeah, thank you very much, nurse. It's a
Yes,
perhaps a good idea for my sister to stay with me. I'll talk to her about it. Yeah, thank you for your suggestions. And
yes,
I'm pleased
thank
with your patience and kindness. Thank you once again.
yes, thank you, Mr. Linga. I'll make an arrangement for the discharge procedure, and also please wait here. I'll take a leave.
Yes, that's nice. We are done with the speaking role play session. Now let me give you some feedback. Everything is going on smoothly and fine. There's no doubt regarding that. But you appear to be making calculated moves. So calculated moves, just how much, what, like that, calculated, measured responses. It doesn't come like a spontaneity, but it appears to be something like artificial. It doesn't look natural. So you're step by step, you're calculating moves and speaking. It should be, spontaneous. Of course, calculated moves is good, no doubt regarding that, because you'll not do any mistakes, but it is not like a natural style. Okay, so there, whether should I speak or not, whether yes or no, very calculated moves. So bit little, then what you can do is, it should be coming like a habit, like a part of real life, natural to the core. Spontaneity is the key. Your calculated moves will be better in the beginning. That should become a habit, and habit should become spontaneity. So in the beginning, you have to be very careful. But afterwards, as you learn these styles, you should improve the fluency, and it should be automatic, right? Yes. Now, second thing is, the fluency is fine. It's a slow, but no matter what, it's good. It should not be, broken. The fluency is definitely there. You should not break the sentences in the middle. You are continuing, though it is slow, you are continuing. That is called fluency. Okay, slow pace is not a problem. Right. Accuracy. You have a problem with accuracy because you have stereotype mistakes. Stereotype mistakes. That means you don't know the concepts in the first place. Just listen without interruption. You have stereotype mistakes. Now, what do you call these stereotype mistakes? The same mistake happening time and again is called stereotype mistakes. You don't know that it's a mistake, and you're habitually committing this mistake. You don't know what is right. You don't know that what you're doing is wrong. You think that nobody told me, so this is right. Okay, let me go on. Accepted. If nobody is objecting, that means you think it is right. But there is Grandmaster class will definitely tell you that it is a mistake. So those are accuracy mistakes regarding grammar. Do you aware about it? Do you aware about it? In this one particular sentence, there are two mistakes. First one is the tense mistake. Do you aware or are you aware? Do you aware or are you aware? Are you aware is the right one. Do you aware is not the right one. Are you aware is passive knowledge. Do you aware means active, from you to out others. So that's the mistake. You get the reversal there. Are you aware of it, not about it? Are you aware of it? Are you aware about it is different. Do you know English? Do you know about English? Do you know English means do you know English? Do you know about English means about English. What is English? When it started? Whose language is it? Who speak more of English? Why is English so special? This is aware about English. Are you aware of English? That means you know English. You can speak English. You can understand English. You can read English. So that is know English is this one. Know about English is who speaks, whose country, where did it start, what are the different things, all these things about English. That is not English, but about English, the history of English, the beginning of English, the speakers of English, the countries of English, when it began, how it became popular. All this is about English. So be very careful when you are talking of it or about it. You totally went into the wrong area. Are you aware about it? Means all the things related to that, not that. Main is the problem. Are you aware of the problem? Are you aware about the problem? So two different things. The next one, second sentence is, if you have well hydrated. If you have have, again the same thing. Have well hydrated means you did hydrate something. Okay, well. No, this is reverse. If you are well hydrated, to you, not to others, but to you. If you are well hydrated, if you are well hydrated, it is your role. If you have, see, like a, are you told and have you told? Okay, right? You have told means you have told somebody. You are told means somebody told you. I think you understand the reversal of it. Don't unmute, don't speak anything. Just stay silent and listen. The Grandmaster is at action. So, are you told about the problem? Means the doctor, did the doctor tell you about the problem? That's the meaning. Are you told about the problem? Means did anyone tell you about the problem? Have you told the problem? Means did you tell or not? Are you told? Did somebody tell you or not? Are you told? Means did somebody tell you or not? Are you informed about the program? That means did somebody inform you about the program? Okay. Have you informed about the program? Means you should inform others. Did you do it? There's totally opposite counterparts. Be very careful in this one. You have done the same mistake twice in the previous example and this example also. They are confused between do and are. Here confused between have and are. Be careful. It's called conceptual mistakes. Conceptual mistake, recurrent mistakes, because you don't know what is right, you don't know what is wrong, nobody told you that it is right, nobody told you that it is wrong. How come it is going on? Because nobody tapped in and tapped off. Somebody did not stop your mistake and somebody did not correct your mistake. So on and off tap is closed for you. Okay, be careful. Next one, I have already closed this button and opened the new button. Don't reuse the closed button. Next one, I would like to tell you some advice. I would like to tell you some advice. Do you think the word you used, tell, is apt here? Tell advice or give advice? You should know. Don't mute. Don't unmute. I'm asking you to reason. That's all. I'm not asking you an answer. I'm not expecting anything because I know the answer. You should know that one. That's enough. And you need not tell me. That's why don't unmute. I would like to tell you some advice. You're telling advice or giving advice or offering advice or providing advice. Which is better? Give advice, provide advice, offer advice. Are three okay? But give is the best option. Give some advice. Offer some advice is the better one. Okay. And directly advise is the best. Give is the good one. I'll give you some advice, good one. Next, number 2. I will offer some advice is better one. I will advise you. I advise you directly is the best. I advise you to refrain from consuming alcohol. I'll give you some advice. Stop drinking. Quality roasted. I advise you to refrain from consuming alcohol. Quality enhanced. Quality enhanced. So try to think of quality. In every sentence, there is I or you or he or me or you or your, something is there. Whichever sentence I gave. That means you are not flaunting passive voice, which is very supporting. Right. And instead of advice, you can use even the best word recommended. Refraining from alcohol consumption is recommended. See the quality of the sentence. I did not teach you anything new. This sentence is not new for you. Definitely not new. Then why are you not able to use this one? You know the reason why? You are taking the mediocre for granted. You are not exposing your brain to beyond the boundaries. Type of locations. You have limitations. There are many people who limit me. They say, sir, we don't want video. Sir, we don't want all these things. Just to give some suggestions enough. The more you limit my involvement, thus less is your accession to knowledge. I'm not telling I'm doing something great for you. I'm doing my duty. That's all. And many people, they pay me fees, but they will not allow me to do my duty because of their own hindrances, problems, personal feelings and attitudes and styles. There are some people who are very proud. They say, we know everything, like that attitude. They don't even attend the sessions. They don't even attend the lectures. I'm giving this lecture. Everyone can come and join here. Only you and I are very active participants. But they think, why should I come when some Muthu Lakshmi is taking the session? Or they don't want to participation. They don't want to waste their time. They think that it is a waste of time. Somebody else, Muthu Lakshmi is speaking. What will I do there, sir? Muthu Lakshmi is doing number of mistakes, dozens of mistakes. If I attend Muthu Lakshmi sessions, I will not do those mistakes. This is what I will think. If I am a nurse or if I am a doctor, I will think like this. My attitude will be different. I'll think like this. Learning from I will do some mistakes, and learning from my mistakes is foolishness. Instead of that, sir is taking Muthu Lakshmi's speaking session. Why don't I go and be in the Zoom session and see the live session and how the sir is giving feedback, what type of mistakes Muthu Lakshmi is giving. Sir will, rip each and every mistake out of the speaking test, and he will explain all these things. People block me. So how can I dance on my platform also? This is my platform, but I cannot dance because they are not ready to receive. You said, sir, your choice, sir. So you are getting all these things. Ask me to do, I'll give you the best. If you know the best, then what I will do. That's it. Closed chapter. I would like to tell you some advice. Some advice. Instead of some, you can say useful recommendations, beneficial recommendations, excellent recommendations. I would like to tell you why only you can tell. There is Avil here. Avil cannot tell. There is Kiran Kaur. Kiran Kaur cannot tell. In your place, if you are absent on duty, another nurse will come. Can that nurse not tell? Then what is your specialty here? I would like to tell you. What is your specialty here? Only you are the only person in the world who gives these recommendations. Why this introductory sentence? I would like to tell you. I would like to tell you. 6 words. Are they useful? Tell now what you want to tell. You did not start the story only. Just beating around the bush. Where is the real thing? Mama, 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 your daughter will come to you. Mama, 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 I want to tell you something. Stop this blabbering. Tell what you want to tell. You did not even start. You did not even start. What is more important? You did not even touch the point of it. Relevant recommendations will be provided. Whether you provide, or Avil provides, or Kiran provides, or Tom, Dick, and Harry, anyone provides, it doesn't matter. Anyone can do the job. Then why are you telling I will provide you? Limit this beating around the bush. Point blank. Some people speak 8 minutes. Why? Because of this. Some people speak 5 minutes, but the stuff will be only 3 minutes. Why? Because of this. I spoke 5 minutes, sir, but all nonsense we have spoken. Not important things we have spoken. That's why we are just passing. Okay? Death missed. Death missed. I beaten. Okay? I is spoiled now. Death missed, I is spoiled. That's what in our language they say. So, just missed death. That means just pass mark. 350 I got, sir. Maybe 10 marks grace mark in that one. Okay. Why this much difficulty? Learn the best, no? Then you will finish in 3 minutes. Okay, still you will get the marks, no? Now add quality to it, no? Relevant recommendations will be provided. Compliance with the suggestions is expected. What's wrong in this? Quality is quality. Okay. Speak some sentences like this, no problem, but at least some sentences you can improve, right? Next one. Tell is not a good word here. It's not a suitable word. Tell advice. What do you mean by tell advice? Tell a story is okay. Give a story is not right. Tell a story is right. Give a story is wrong. That means there are words which go with words, hand in hand, or hands in glove, hand in glove, or hand in hand. They go together like husband and wife, like friends, two lovely friends. Otherwise, the hands don't match. You understand? Father and son, they hold their hands. Elder brother and younger brother hold their hands. Brother and sister hold their hands. Husband and wife hold their hands. Two lovers hold their hands. But if they are not holding their hands, that means that there is that relation is not there. That commitment between two words should be tested. Don't just throw words like that. It has to be avoided. It has to be avoided. It has to be avoided or avoided. To be avoided. You have to avoid. You have to avoid. But it has to be avoided. Passive voice. Third form. You have to avoid drinking. Drinking has to be avoided. And you used it in a wrong sense. Drinking has to be avoided. How can you say this? Where is the passive form? V3. The next one, he may. He may. Why you repeated this? He may. You told, no? Then again got stuck. And again you are saying he may. So why are you repeating this? You can continue without repetition, right? Have you forgotten? Have you forgotten? Or did you forget? Have you forgotten is present perfect. Did you forget is simple past. Are you forgotten? The same mistakes like how you are doing. Are you forgotten? Means somebody forgot you. Did you forget? Means you forgot something. Are you forgotten? Means somebody forgot you. Be very careful. Be very careful. Then you said advices. First you said advice. That's correct. Then afterward you said some advices. Is there a plural for advice? Noun. He advises is there. Advice. See. Advise. Z. This is S. C. Z. S-E. Advise. How can you say advices? Is there a word in its plural form? Advices here. Advice. Uncountable. A piece of advice. Some pieces of advice. But advice is uncountable. You cannot use S to that. So that's fine. Now you can unmute and you can give your feedback regarding the session, how you enjoyed the session or benefited the session. I don't give you 10 different sessions, too many sessions. One session, solid session, improve and get back to me tomorrow. Yes, you have time, 1 minute.
Yes, sir. Firstly, I thank you for this session, sir. And each each word, the grammatical mistake and minute errors has been noticed by your lecture. And
Errors have been noticed. Errors have been noticed, not has been noticed.
Okay. Errors have been noticed, and definitely this session will bring me to the next level, and I'll correct my mistakes as per your or comments. And I hope it is really beneficial for me to correct my speaking and the structure of building up the sentences. Is, I'm thankful for this session actually.
Yes, that's all for now. We had a session with Muthu Lakshmi. She's a good student. Everyone is good. We have our own drawbacks. For example, sometimes I am, adamant. I'm a good teacher, maybe not the best teacher. Everyone has. So every one of us have different positives and negatives as well. Otherwise, we are not human beings, but angels. So we have our own drawbacks. Whatever it is, there is no problem. There is no problem. We are doing something that's more important. So practice on a regular basis, all the students. See, she has done a lot of mistakes, no problem, but she's ready to learn. That readiness to learn is very, very important or pivotal to the, the procedure called learning. Learning. Then only you can learn. Otherwise, it's difficult to move forward. Right. Thank you very much. For those who are watching on the YouTube, yes, my dear students, we are providing extraordinary sessions for all the students, all the professionals. Okay, all the 12 medical professionals we are ready to give, and personalized sessions like this you'll be attending. We have reading sessions, listening sessions, writing, and also speaking sessions. So we have collections of sessions like a full course, 1 month, 2 months, and 3 months courses, 3 month courses, and we have a clubbing of skills like some people who fail in only reading and listening. They're coming, they can join, subscribe for reading and listening, different types of packages. Those who want only writing and speaking, you can go for the productive skills and different thing. Whatever you want, you can contact me on my number, and it is an +919877867360. I repeat, 98, sorry, +919877867360. Grand Master Class Trivendra. Have a nice day. See you in the next session.